Okay, so this is our clinical documentation presentation. So I'm merging the clinical documentation 1 and 2 together. So this will be CBP 201 and 202 together. They just kind of flow. The first half was kind of about documentation itself. The second half was just about a couple elements of that documentation. So I'm just kind of putting those together to make it a little bit easier and to make it flow a little bit better for you. So, first thing, our learning objectives for today identify the importance of using a system for documenting any kind of care that we're giving to the client, to assess the SOAP charting system. So, the SOAP charting system is a system of notes that we take, and we'll talk a little bit more about that. And then demonstrate competency. So you're going to be doing some of this in the upcoming weeks as well. And so you'll kind of show us uh, how well you understand the SOAP charting system. So in addition to the S and the O there, it should also say A and P because we put those two together. Um, and then perform an initial client intake. You're going to be starting that hopefully within the next week here, along with a verbal consultation too. So for this, again, the first part that we're going to talk about is just simply the documentation itself. What is this documentation in general terms, including why it's important, and why we might do it in certain ways versus other ways. And then the second part is actually going through the S, the O, the A, the P. So the SOAP notes themselves, and just talking about what each component is and how to actually write in the notes for each one of those parts. Um, so, why do we do this in the first place? To collect data, to build relationships with the client as well, and to build trust with that client. So, any kind of successful relationship with a client requires a variety of both verbal and nonverbal communication skills. So, what we're saying and what we're actually feeling and sensing from the client, and what they're feeling and sensing from us as well. Um, if you are an LMT that can develop those good communication skills, you're really going to be able to help them that much more on their path to success in terms of their health. Um, and this is going to help just to develop a general treatment plan in general, okay, which is the basis for everything that we do as massage therapists. So, for communication, some things to be really in the know about. Okay, so first of all, and we've talked about this before, is to be very present. We've talked about it in relation to just the treatment itself, but while we're doing an intake, while we're trying to do an assessment on this client, we're talking about a first time client coming in. We also have to be very present. So we have to be very aware of different distractions there may be, and these are distractions for ourselves and the client. So look around the area. Is this an area that's really conducive to doing an intake, to doing an assessment with that person? Or are you the therapist, or are the clients going to be distracted? Another thing is don't jump to conclusions. Okay, for that, just make sure to hear them out completely. They may start saying something, and we may start thinking something as they're saying it, but it's just really important not to jump to conclusions. So we hear what they have to say full on out before commenting on anything, and really try to process before you even answer them with anything. Um, we have to practice understanding and compassion as well. So, developing really good listening skills, listening to what they're saying and kind of what they're feeling, and kind of looking at their body language and everything too. But develop those really good listening skills and acknowledge their feelings as well. Basically, summarizing what you hear. I hear you saying this. I understand this. It's things that you're kind of parroting back to them to get them to understand also that you're kind of right there with them the entire time. And then also understanding the client's strengths and their healing abilities as well. So one of the things is just being really encouraging for them. Oftentimes they're coming in, and it's not just for a nice feel good massage. It's for sort of injury care, or they're feeling like just not good, not right. So when they come in, some of them can be pretty self-deprecating. They can be, "Oh, I'm always like this, and I feel horrible, and I'm in a bad way." But we want to make sure to be encouraging and just really focus on any kind of positive that we can find, and help them to understand that this is just a temporary situation for them. Okay, and always moving in a positive direction that way. Okay, the end goal is to be something different. So let's not just focus on how you're feeling right now. Okay, that can inform what we're going to do and what we're going to talk about, but let's not focus on that. So, and our words also can influence their perceptions in a positive way too, or a negative way. So, we want to focus on the positive. So, instead of saying things that are more negative, or get them to focus on the negative, going, "Oh yeah, you look like you're out of whack. You look like you're tight. You look like you're tense," or something like that, then you're changing that verbiage around to just, hey, let's get you feeling this way. Let's get you straightened out to this way. Let's make sure that we're going to run through this and that, and we're going to get you looking this way. Okay. So we're focusing on the positives. And so everything that we say can influence their perceptions about how they're feeling, to get them out of this negative mindset into a positive mindset. So, interviewing. So we say interviewing, but basically this is just when a client comes in and we're going through the intake form with them. Okay. Whether you have already had them fill it out and you've looked through it already, or you just had them fill it out right when they got there and you're looking at it for the first time as well. But for the intake form and for interviewing, we have to think about this as sort of this fact finding mission. Okay. So we're investigating. Think about any kind of like investigative news program or anything else that you've watched. A lot of those are on evening, Dateline 2020, whatever. But whenever they're interviewing people, they're asking open ended questions. They're trying to get at a truth. And the only way for them to fully understand what this person has gone through, what they're going through, how they're thinking about the past, present, or future, is to ask probing questions. And so that's what we're going to try to do with this interview. Okay. So we're creating a relationship with a client. We've already kind of talked about that a little bit, but we are, there are calls for attention. Okay. And oops. We're going to go through all these here in just a second. So, creating relationships, sharing info, developing goals, choosing to implement solutions, and evaluating progress and providing feedback. These are all rules for interviewing. We're going to go through these one by one here in a moment. Okay, these 5. So, the first one is creating a relationship. Okay, so yes, this does call for attention and understanding and compassion and belief in the client's personal strengths and abilities. So again, we're thinking about positive things. We're not just focused on the negative and how bad they're feeling in the moment. We're looking at moving towards the future and how they're going to feel in the future and how they're going to view themselves in the future. Okay, so what are their strengths, what are their abilities, and what can they kind of call upon in order to get themselves to be better? Opportunities to build a relationship include phone calls with them and asking for permission to touch too. So you may want to follow up with a phone call. It's not like phone calls beforehand or being like friends with them or anything. It's just calling up every so often. If you haven't seen them in a couple weeks or a month later or something, just calling to follow up and see how they're doing, how they're progressing. And asking permission to touch while you're with them as well. This is more just allowing this communication to take place. So, hey, I'm going to check your hips for a little bit of hip spring here. I just want to make sure one hip isn't rotating forward or backward or something like that. Or, hey, do you mind if I do this? Because I just want to check this out. So, asking permission to touch is developing that relationship so they feel a little bit safer with you. And so this is developed before, during, and after every session. every session, not just the first session, but every session, where you have this constant communication. Okay. So sharing information is the second part. Okay, the interview is a very it's an information gathering process. Again, like I said in the beginning, we're trying to find out the who, why, what, when, where, why, whatever that got them to this point. So we ask questions that lead to pertinent information and listen very carefully to any of their replies. I know some folks are just, their brains are spinning as people are talking. You're trying to figure out what you're going to say next to them, or you're trying to process what they're saying and come up with a solution right then and there. But sometimes the second, third, or fourth thing that they say is going to nullify something they said in the beginning, and you can kind of throw that out, and you hear the real reason why they might be in there. Responses lead to a deeper understanding of them and their health condition, because you hear a little bit more, a few more symptoms, a few more things that have happened to them. And maybe it's not even physical. Maybe there's some other mental or emotional things that are going into it. And that interview also provides a good Q&A session between the client and the therapist. And this is not just Q&A for the therapist, like me, the therapist, asking them, the client, all these questions and having them answer all the time. It's a good time for them to ask questions as well about maybe what they're going to be experiencing during that session too. Okay, which kind of goes in the next one too. But we review the intake form, we find out what the client's goals and expectations are for the visit, and we kind of go from there. We use the intake form also to begin a direct line of questioning regarding any kind of history and current, and this is kind of checked, cut off there. Where are we here? So we use that intake form basically. So once we start asking the questions, conditions. Once we start asking those questions, we look to that intake form, and that's our first line where we say, okay, this is what they filled out. Now they may have answered two of my questions or three of my questions, or sometimes none of them if they didn't fill much out. Because some people are hesitant to fill out a lot on those intake forms. But they also may have given me one or two little things that I can kind of take off on and ask more questions. So that's the last part. And then you're going to also explain, and this got cut off on the slide here, at least to me, not sure what you're seeing, but you're going to explain what the client can expect during a session as well. And every little part of it, what you'll most likely work on, what you're going to be trying to determine during that session, that they need to communicate with you, and you're going to communicate with them during the session if they're coming in for something specific. But we want them to know what they're going to expect, especially if it's their first time there. So the next, we're going to develop some goals for health. Okay, for here, we're understanding the client's needs and identifying any kind of goals that direct the treatment plan and illustrate progress over time. Basically, in a nutshell, from what we just gathered, what is my plan of action? And I'm going to share that with the client as well. Okay, any kind of functional goals are going to be based on the client's activities of daily living, or ADLs. That should be a small s at the end. So ADLs, that's activities for daily living. And you may see this a few more times during the program. You also may see it in the literature when you're looking at massage related things where they say ADLs all the time. That's an acronym for activities for daily living, just so you know. So those functional goals are going to be based on that client's activities of daily living. These are the things that the client typically does in a normal course of a day, be it work, be it recreationally, or any other things. But we want to make sure our goals are related to that. And oftentimes clients are going to say something about that too, where they say, I just want to be able to squat down, while I'm picking carrots out of the garden or something like that. Or I want to be able to do this, or I want to be able to do this much. And so our goals are going to be dependent on what they usually do on a daily basis, because that means it's a little bit more tangible, and also they can visualize these goals a lot more. And then we're going to choose and implement solutions. So the term solution here is used because we want to make sure we're not just saying goals. If we say goals all the time, that means that it's something off in the future and we hope to get there. That's our goal, but it may not happen. But in here, we're using the term solution. So we're going to create solutions for them and say, our solution is going to be you coming in this many times, me using these different types of techniques, um, and you doing this at home. So these are the solutions to what our issue is right now that you came in with. Okay, so it's always client centered, and it's always based on solutions to their kind of hiccups in life. Okay, and then we're going to evaluate our progress and provide feedback. So this is during the session sometimes or right after the session, and it could be after so many sessions too. But we're going to, based on those goals, we're going to say, okay, we've done this now. I've seen these results because the client should know, hey, you did sense something different. You felt something different because sometimes they can't feel it or they may be thinking something different. But in either way, it kind of strengthens their understanding of what you've provided for them and also gives them a little bit more hope too when you say that, hey, yeah, I'm feeling some changes here and these are positive results. Okay. Another part of this is communicating with the healthcare team. Okay. So I say team here because sometimes people are coming in under a referral from another healthcare provider, and you become part of that healthcare team at that point. So these healthcare providers can be anything from chiropractors to orthos to PTs or something like that. But you're part of that care team. Okay, so there are going to be some requirements if you're part of this team of people that are working with this one client. And this is where some of that SOAP charting comes in. But when we do this charting, everything, and again, we haven't gotten to what the actual SOAP notes are, what they look like, or anything. We're just giving some background information as to what we need to do and why this stuff is important first, before we get into here's your example of it, and this is what you're going to do with it. So, with all SOAP notes and with all kind of medical charting, we always have to make sure that we're typing all correspondence. Most of the time, this stuff is sent digitally nowadays, but even if it is sent on paper or snail mail or anything like that, we need to make sure that everything is typed. And so you fill it in with a PDF filler or something like that online, and then you print it, and then you can send it along on paper, or you just send it digitally. But we're going to type all correspondence. We're also writing in a narrative format within a letter format. So it's going to be like a letter that you're writing, okay, to this person from this person. Here's the issue regarding whatever. But this is a narrative format. So this is full sentences, short answers, or short paragraphs, or things like that, with all the information that they're going to need. Okay, it's not going to be abbreviated into like a bunch of acronyms and all that stuff. We're going to use the client's full name as we have it, so they know who we're referring to as well, and it's less of a mix-up when it gets to them. And we avoid any kind of handwritten fill in the blanks types of forms. Okay, we'll throw those out, or we're going to scan them in, and then we're going to type things in there. And avoid any kind of abbreviations and symbols, because as massage therapists, we have our own language. I think if you Google massage therapy acronyms, depending on the website, you may have 100 to 500 different acronyms that we may potentially use. And it all is sort of your setting, and it's setting dependent. So don't worry, you as massage therapists aren't going to have to like memorize all those acronyms. But we have some of the similar acronyms of other healthcare providers, but we also have a lot of our own that we just kind of share within our own licensed massage therapy circles. So we can't use those abbreviations because other healthcare providers just might not know what we're talking about. We also provide information very clearly and promptly. So we get to the point really quickly. We don't add in a lot of extra fluff. It has to be just dealing with the problem at hand. Be very brief, summarize the details, and state any kind of progress. And progress is always going to be important when we're dealing with a insurance company or other healthcare providers, because they want to see that progress. If there's no progress, that means it's not working as well as they had hoped, and basically you get cut out of that whole team. Um, we also enclose copies of the SOAP chart notes in addition to the report if requested. If it's not requested, we don't have to give them our SOAP notes. But these are also copies. They're not the original. So we send a copy, we file the original with us, okay, and we send them a digital copy. So now that referring provider, so let's say a chiropractor sent you a client or a physical therapist sent you for with a client, they're going to ask for certain things, or they're going to want or require certain things. So they're going to send you with a diagnosis. So they're going to say, this person is suffering from this, or this person has this condition, including ICD codes. And now these ICD codes are basically, these are common codes across healthcare providers. These codes basically state exactly what that person's condition is, and they're also used for treatments too. And you'll get to know those if you're dealing with them, and they're really easy to Google too. Okay. They'll also tell you the frequency and duration of treatment. So they'll say, we need this person, person A or person B, whatever. We'll need this person to see you at least once per week for X number of weeks, for 30 minutes at a time. And it may tell you where to treat. So anterior shoulder in the anterior deltoid compartment or something like that, or back, low back, QL area, glute med, whatever it is. But it'll tell you where to treat too. And this is basically so that it kind of it satisfies insurance requirements too, because they need to know exactly what's being done, how many units or how much time it's being spent doing it, so that they can chart, hey, we started here, we had this many treatments, and now this person is here, and so this is working or this is not working. Okay. So this is if a referring provider sends you a client. Now, if we're talking frequency and duration as well, if the referral says, hey, this person needs once a week for 6 weeks, so 1 times a week for 6 weeks, then that is exactly what you must follow. So you don't do 2 times, 3 times a week. You don't go to 8 weeks or anything like that. You have to follow it to a T for them to be basically follow along, and so they can see, hey, progress is made or not as much progress is made, and so the insurance company also can see, hey, this is what we've provided and these are the results. Sometimes the provider, though, the chiropractor, physical therapist, whatever, will also defer to you sometimes, and will just say, hey, I need this person to see you 6 times. You do whatever your expertise allows you to do. And so that's kind of nice too when they send you something like that. And communication is going to be expected between the referring providers and massage therapists. So just remember that too. If a chiropractor or someone else sends you something along, it's expected that you do communicate somehow with them. It could be a call, it could be email. A lot of times, digital communication is best because then there's a trail as well. So most people defer to a digital format when talking back and forth between providers. So again, why do we document? Okay, why do we use SOAP notes, this format specifically for documenting? It's because SOAP notes are a very standard format that all healthcare providers are taught at some point. And so they know how to use that format. They have the exact same subjective, objective assessment. You know, they have the same exact thing that they're looking for in all their clients as we're looking for in our clients. So it's just an easy way to move clients back and forth through the system. Okay, they're used by medical doctors, PTs, chiropractors, nurses, other medical professionals. Okay, so again, it's a simple structure, allows flexibility from the person to go from one provider to another, and it documents the patient's health information, their goals, any kind of findings that the practitioner had in treatment for the session, and the self-care routine as well that the client is doing on their own, whether prescribed or not. So it's just a way to track that person and their progress as they go along the medical journey. Okay, so now part two, we're kind of getting to the SOAP notes, the documentation itself. So now we've gone through what it is or why it's important to do this documentation, who's looking for it, how we interact with the client, and everything. So now we're going to get to the documentation itself. Okay. So the documentation is called a SOAP, SOAP. It's another acronym, and it stands for subjective, objective, assessment, and plan. Okay, so again, remember that all medical providers are going to be following this SOAP standardization when they write all their notes. So, subjective, objective, assessment, and plan. So, we're going to go into each one of these briefly first, and then we'll go into more depth after that. So, subjective, basically, this is data provided by the patient. So, again, remember that this is data provided by the patient. So this is subjective. The patient comes in and says, I'm feeling this way. I think this happened. This might be going on in my body, but it's very subjective. So the data is provided by the patient for this. So these are the symptoms and any kind of functional limitations like range of motion or strength or anything like that that they're feeling. But again, symptoms, functional limitations provided by the patient, which is why it's subjective. Objective now, and the subjective is stuff that they're going to fill out on the intake form too. When you ask them, hey, what happened? What are the symptoms? What are you feeling? Whatever. That's what they put on the intake form. And you're still going to be asking more questions, like we talked about earlier, to see if there are even more things that they hadn't thought about. But objective is the second part of the SOAP notes. Objective, the data is provided from the practitioner. So not the patient anymore this time, or not the client, but the practitioner's perspective. So this is stuff that we can measure. Okay, again, this is always stuff that we can measure. So these are using any kind of movement test, which you might do a little bit later. Palpation findings. So these are things that you, as the therapist, have found, and you're going to write these down or type these down. So you're going to say, there was this lump down at this area, and you're going to say exactly where it was. This is objective. This is not subjective that there was a lump. This is actually something that was there. Your visual observations. So the patient's left shoulder was elevated approximately ½ inch to an inch higher than the right shoulder. Again, this is objective. This is not subjective. This is, was it raised? Was it not? Yes, no, it's objective. As well as the treatment you provide during the client session. So you can say, I did Swedish for this amount of time. I did trigger point therapy. I did this, I did that, and I did it in these areas. So this is objective again. This is something that was true. It happened because you did it. And then the client's immediate response to that treatment too. I did this. This happened with the client. So then there's the A, the assessment. The assessment is any of the functional goals and outcomes that we have based on activities for daily living, the ADLs, once again. So these are things that we're going to assess and say, okay, based on our session, based on what we've talked about, these are going to be our goals that come out of this. Okay, things that we can assess as we go along on this journey together. And then the plan itself is going to be the treatment. So, not just the goals, but how are we going to achieve these goals? So, the treatment recommendations: this much massage, this much time, this many times a week or a month or whatnot, as well as any kind of self care routines that you give the client. So, I want you to do this stretch, and I would like you to do this or whatnot. That's all included in the plan or the plan of action. Okay. So now we're going to go into this a little bit more depth here in a second, but there's a little bit more. So there you found out what the S, O, A, and P mean. Okay, and you'll see a chart later for this. You'll be given one. So now, before we begin the subjective and objective sections, and even the A and the P later, we're going to create some guidelines for charting and the intake process itself. So make sure that any charting that you do, okay, while you're writing that SOAP note, that charting should contribute to the therapeutic relationship, not detract from it. So all the information that you put in there has to be very specific to the client and very specific to what you found and what you plan to do with that information, not extra information. Okay. You don't need the client's height and weight. You don't need the client was a nice person and they had this emotional response and things like that. Okay. That's a little bit different. So you also have to be very attentive and maintain those good listening skills, which we talked about earlier. And on the SOAP note, black ink pens are required. Okay, use black ink pens on SOAP notes, because if you do need to photocopy them or scan them or anything like that for any reason, it is something that translates the best because it has the highest contrast between the white and the black. And so it actually gives you the most clear photocopy or fax or anything like that. So you have to use black ink pens when you're writing a SOAP note if you're going to handwrite it. And then we measure everything. Okay. We can't prove any kind of progress if we don't measure it. So that's why we do this first session SOAP note, and then we do SOAP notes every time after that so that we can see what kind of progress we've made from the first session to the sixth session. Okay. Again, the team is going to want to know, and the insurance company is going to want to know as well, because they want to make sure that whatever you're doing or whatever is being paid for is something that's worth the money and worth the time. Okay. Also, avoid any kind of vague statements, such as the client is feeling better after this treatment or anything like that. So be very specific when you do this. So instead of saying the client is feeling better, saying the client had a pain scale, or was on the pain scale at an 8 when they came in, 8 out of 10, and now they're at a 3 out of 10 or something like that. Rate the intensity of pain. And then use consistent terminology to measure anything too. So mild, moderate, and severe, you can use those. That's pretty common language. Or you can have a scale like right there. So normal is 0 out of 10 scale. Mild is 1, 2, or 3 out of that. Moderate, whatever. But if you're going to use this, be very consistent. So from the first SOAP note to the second to the third to the fourth to the fifth to the sixth, use the same scale. So don't switch from saying just mild, moderate, or severe to the next SOAP note saying 0 out of 10, 5 out of 10, 7 out of 10, or anything like that. Just use the same exact thing every time so that it's very consistent, and so you know where you went from first time to second to third all the way to sixth. Okay. So here we have each individual part. Okay. Each individual part. So you had a general overview already when I introduced the SOAP note. And now we're going to go into just a little bit more detail so you can understand it a little bit more and where this is placed or where you're getting the information from. The S, again, is the subjective. So again, remember that was provided by the client. It is very subjective. I'm feeling this. I think this happened at this point or whatnot. It's not measurable. Okay. So it's provided by the client, includes a health history and current health information. So this is all coming out of your intake form. Then it's also coming next out of your talk that you have with them, too. So when you ask them questions, they may be giving you subjective information as to how they're feeling. So the intake forms, that first assessment or that first comprehensive sort of exam that you do with them, and then use the subjective section of the SOAP chart as an ongoing record of any kind of details on their current health status. So if you're writing a SOAP note every single time, that SOAP note is going to be specific to that individual session. So if you did something on August 27th and then September 2 and then December 24, each one of those, if given their own specific SOAP note, the S is going to be a subjective understanding of their condition at that time. Okay, so current concerns, current physical symptoms, changes in functional ability from that last time, and any kind of impact on that client's daily routine as well. Okay, so that's subjective. So any kind of health concerns here should be listed at the top of the SOAP note. So this is the region that the patient is seeking care, whether it's their first time or their sixth time there. And it could be defined as any kind of injuries, medical conditions, symptoms, goals for maintaining health or preventing any kind of disease as well. So examples of this: care for injury sustained in any kind of motor vehicle accident, MVA. That's another one of those acronyms that we use across the medical field. MVA is a motor vehicle accident. Or work without pain or numbness or relaxation. That might be one of our goals or something like that. Um, Also, yeah, any kind of information that directly affects the care that you're going to provide for that current date of service. So if they're feeling one way, that's going to go in there and it's going to directly affect what else you write on that SOAP note for the type of treatment that you gave them. So sometimes clients do have multiple concerns when they come in. You have to prioritize in this because we can't get to everything. Um, there may be an exception to some multiple concerns where you say, well, they came in with left low back issues, and that was directly related to their left hip issue or something like that. Well, I can work with both of those because I know they're related, or I found out that they were related in the course of the session. And so I'm killing two birds with one stone there. Okay. Symptoms. Symptoms, much of this is recorded again on the intake form. So this is still the S here that we're talking about. So the symptoms, stuff that they put down in the intake forms, we're going to condense all this stuff. So they come in with, let's say, 3 things on the intake form. And then maybe while you're talking to them, they list 3 more things. So we have 6 things. And so you have to, as a therapist, just kind of say, well, those are related. I'm just going to mash those into one, but I'm going to keep these separate. These are all their concerns here, but I'm going to condense it into the initial SOAP note here. So there are different things that you might see. So commonly you may see general symptoms, lymphatic systems, or musculoskeletal symptoms. And so there's just an example of some of those. So if it's a general symptom that you might be putting on there, the person may complain about fatigue or pain in different areas of the body, any kinds of signs of stress, fever, posture, and general function. Okay. So these are things that they're coming in with. I just feel this kind of stuff. Okay. Lymphatic, where they may have some lymph nodes that may be swollen in different areas of their body, any kind of edema or like water retention anywhere. Might be some things that they're complaining about. And then musculoskeletal things like tension in a certain area where they feel like tight in a muscle or something like that, or that they don't have strength somewhere, which means that something else is kind of turning that off at the time. Muscle and joint pain, stiffness, swelling, those are all a whole bunch of symptoms that they might put on there and that you can get either through your talks or when they put them on the intake form. So that goes in that S, subjective. Okay. And then once that patient has identified the symptoms, then we ask for more descriptions. For example, if the symptom is pain, and this is all during the initial um, interview that you do with them, if the person says, I'm in pain, then you can maybe ask, well, is it a sharp pain? Is it shooting pain? Is it dull, aching? What does it feel like exactly? Pins and needles, electrical activity? Um, so you then ask the person to identify the precise location of the symptom too. If they say, I got pain in the shoulder, well, the shoulder could be back of the shoulder here, the side, the front. They may be talking about up here on top. They may be talking about even closer to the neck area. So you have to ask them, what do you mean by the shoulder? And give me the precise location of that, because that can tell you a little bit more about where this might be coming from. And then you also ask them to rate that intensity of the symptoms. So on a scale of 1 to 10, 3 to 4 being this, 5 to 6 being this, where do you find yourself? Okay. And then you saw that rating scale that I gave you earlier a couple slides ago too, if you wanted to use that. Okay. You also note how often that symptom may be occurring. So the frequency and duration. So it happens every day and it happens for about 2 hours, 3 hours, or 5 minutes. But then you list it as general, so seldom, intermittent, or frequent, or something like that. You can have a general listing or be very specific, when you write it down. And it's always up to you how you want to do this, like twice a day, 3 times a week, or hourly, whatnot. So it's up to you how you want to record these. Again, just be very consistent with how you record these. Okay, how long the symptoms last when it occurs. So it's only a few minutes, it happens for days, it's been going on for weeks, months, or years, and when it started. Okay, that'll let you know this is an acute stage of this in the first few days, or maybe it's subacute from 3 to 7 days, or this has been a chronic condition for years. Um, and then ADLs, activities of daily living. Okay, when you're doing this, if you bike a lot, if you garden a lot, if you sit a lot, if you stand a lot, if you run a lot, okay, what makes it hurt more? What makes it feel better? What are you feeling while you're doing this? What are the things that are actually affecting what you're doing, and what are we trying to get to eventually? So that was all the S. So that all goes into your subjective findings. Okay. I know that sounded like a lot, but really it's not when it kind of comes down to it. Okay. It's just basic responses where you just say, hey, client comes in feeling this way. I asked them some more questions to try to pinpoint how they were feeling, and they gave me this information on top of that. And so I wrote that down, as well as when it was happening, how often it was happening, and where it was they were feeling it. That's basically in a nutshell what it is. Okay. Then we get to the O in the SOAP note. Okay. And the O is objective. So again, this is from your perspective now, the practitioner's perspective. So now we are going to try to measure things. So the other things we couldn't really measure so well, okay, because it was more of an idea. And now these are things that we can measure a little bit more. So we look at treatment applications. We're saying we're doing these techniques, we're doing Swedish techniques, we're doing trigger point therapy, we're doing myofascial release. We're doing it on the left side QL. We're doing it for 15 minutes or something like that. This is all measurable stuff. Then you also talk about the patient's response. So we had hypertonicity, or really dense tissue in this area, while I was working, and I did this kind of stuff. And this was the response: softening of the muscle, this happened, that happened, shaking in the muscle, whatever. But you put that in there, it's subjective. You can measure that. You can say this is exactly what happened when you worked with them. Okay. Again, be very clear and be very concise. No extra information there. Okay. Stick to just the details, also within your scope of practice. And what that means basically is that we do not diagnose as massage therapists. We can say, hey, I felt this and I saw this. But even if it is like 10 out of 10 symptoms that it is a labral tear in the hip, you can't say, I believe it's a labral tear. Based on all this stuff, I believe it's a labral tear because I kind of know what labral tears are. Or I've even studied this stuff. Okay, we can't say that. We can't diagnose. Anytime you tell someone exactly what something is, that's a diagnosis, and we can't do that. So instead, we can refer them out to someone else, and we can say, hey, I think it'd be a good idea for you to see someone who deals with this, and you may be able to give them chiropractor, PT, whatever, and just tell them these are my findings. This is kind of these are the symptoms that I found, and see if they jive with what they find. And so you haven't diagnosed, but you've sent them in the right direction. And you can also treat something that you are not diagnosing. So you could say it's 10 out of 10 that it's a labral tear. So I'm going to treat it as though it were a labral tear. I'm just not going to call it a labral tear. And I'm not going to tell them that I think it might be a labral tear or that it's 10 out of 10 a labral tear. Okay, so I can treat it accordingly as well. Okay, but this is all very objective information here. Okay, so measurable findings. So again, this is in the O. So we gather any kind of objective measurable data. So visual visual observations. So we can look at their posture. We can use a posture board if we want and measure them against lines and plumb lines and horizontal lines and things if we want. But we can measure it and just say, yep, right shoulder higher, left hip higher, posterior rotation of the hip, the foot is externally rotated or everted or something like that. Palpatory findings, so that's us touching them and pushing on different parts of their body. So we're looking for different things in their tissue texture because we are soft tissue therapists. We're not working with bones and joints. And then we identify any specific locations as well. So these are our measurable findings. And then we can test them. Passive testing, active, resistive range of motion, these all tell you different things. So passive range of motion is us actually just moving someone through a range of motion. Active range of motion is them actually moving themselves through a range of motion. And we're checking that, we're looking at that. And then resistive range of motion is when I'm moving something against a resistance too. And these all tell us different things about what might be going on in the system and at the joint and things like that too. And then treatment. We document the length of the session again, the massage techniques that we use, so trigger point therapy, myofascial release, anything like that, anything that was applied, okay, based on our findings and based on what we talked about during that subjective session. We record the treatment in a couple different ways. So first we look at the big picture and we say we did an hour-long Swedish massage, 30 minutes prone, 30 minutes supine, so facing down, facing up. Then we're going to fill it in a little bit more detailed. We're going to say we use these types of techniques to try to get at some different things. And then we look at the patient's response, third. Okay. So after these techniques, then we kind of quantify these things and say we started this way and we ended this way. Okay. So this is a sample here. So in the O, in the objective, you might say left pec major, hypertonic or hypertension, 7, was at a 7 out of 10. And we changed it to a 3 with effleurage, petrissage, and linear friction, which is kind of in line with the muscle fibers. So we were working on the left side pec major, and when we started, they were at a level 7 out of 10 with their tissue and the pain or discomfort, and we changed it to a 3 out of 10 with effleurage and petrissage and linear friction. Okay. And we may also talk about the rhomboid. So our rhomboid means right rhomboid. Okay. Our right rhomboid in the back there, we had adhesions and it was at an 8 out of 10. And then we changed it to a 4 out of 10 with a little bit of myofascial release and cross fiber friction. So we're using acronyms in our own SOAP notes, but if we were to give this to another professional, we would actually spell it out completely for them. And that is in the objective or O section treatment. Okay. So, just as a quick review so far, interviewing we talked about. We're creating a relationship with them. We're trying to share information back and forth, developing goals with them, and then we choose and implement the solutions that we're going to use based on these goals that we've kind of set. This is through the interview process. And then as we go, and that's what we're talking about now, we're going to keep evaluating progress and providing feedback either to the client or to the team. Okay. And again, subjective, the data is provided by the patient, and we're talking about symptoms and functional limitations that they feel that they have. Objective, the data is provided from the practitioners. Now we're going to do some movement tests with them, palpate, poke around on them, do some visual observations, as well as do some treatment with them and see what the response is. And then we're going to move into the assessment and the planning. So that's coming up here. Okay. So that assessment, that's the third part of the SOAP note. The assessment comes back to the client goals that we discussed. Okay. So earlier on, we talked about a lot of different goals that they might have. So, for example, the client, if they're complaining about any kind of pain walking or playing basketball or doing things like that, then the goals are going to be to decrease the pain with those same activities. So, if they're at a 7 out of 10, while they're walking and their calf muscles is 7 out of 10 in pain, we're going to try to decrease it to like a 3 out of 10, a 2 out of 10, or something like that. And we're either going to use like a 2-week block or a 6-week block with them and say our short term goals are 2 weeks or less. Long term goals are going to be like 6 weeks or more. Okay. So short term goals, long term goals. In those short term goals, we may have like a few blocks of short term goals to get to that long term goal. Okay. So assessment, looking at the goals, what are we going to do with them? And we're going to try to achieve these things. Okay. So a good short term goal is one that takes them out of crisis mode in the shortest amount of time. So if they were at that pain level of 7 when they came in and it was constant, we would want to show improvement in a goal to work towards. So a short-term goal, decrease the pain in the neck from a constant 7 out of 10 to a 3 out of 10 for 2 hours with sleep in 2 weeks. Okay, or a long-term one might be, say, decrease that neck pain from a 7 out of 10 to a 2 out of 10 or 3 out of 10 for 1 hour with sleep in 6 weeks. Okay, that's saying that, they had pain for 2 hours. Now it's pain for 1 hour. Okay, all good goals. So this gives the client goals and shows the insurance company too improvement if they're billing for the client's visit as well, because they won't pay out if you're not reaching goals and you're not progressing in the right way. So if they are billing insurance, the client must be discharged once the client plateaus. So basically, progress, plateau. Guess what? No more insurance. Okay. So we want to keep showing progress, even if it's a little slow, but we want to keep on showing progress with that person if they are taking insurance as well. And so with the insurance folks, make sure you are doing those SOAP notes for sure. And then the last part is the planning. Okay, the plan section covers how the therapist plans to get the clients to reach their goals here. Okay, so remember we said this was the treatment recommendations and the self-care that we are giving them. So the following are a list of potential ideas. Okay, so you may, in this treatment part, so we're the massage therapist, so we'd be that second part there. So continue at one time every 2 weeks for however long. So here it's saying one time per week for 4 weeks and then reassess and see how they're doing. So that could be part of the planning. We could also refer them to a chiropractor, to an acupuncturist, a medical doctor, or physical therapy as well. We could say, hey, based on my understanding of what this is, I think I want to refer you to this person or that person. And then you can still do massage along with. You're not just like handing them off, but you can still do massage along with, but that may help as part of a team. We may talk about doing some hydrotherapy, so using ice for pain or anything like that. Hydrotherapy is basically using any form of water. So, ice, wet or moist heat, vapor, things like that we use for different things. We may tell them to increase their water intake, and this is good for like fascial hydration. We may also recommend certain stretches or some routine to them, and we'll cover that stuff later on. And there's other things that we can maybe put in this treatment plan for them as well. Okay. Obviously, the hands on stuff that we're doing with them is all the massage stuff. But yeah, there's a whole slew of things that you can do with a client to help them get better faster, too. So don't think that you have to do it all yourself or you have to be like the savior here. Sometimes having more options for them is going to help them, too. And then they're going to trust you a little bit more, too. Okay. So that is the S, the O, the A, and the P of the SOAP notes. And the SOAP notes themselves, there are online SOAP notes that you can get, like SOAP note charting for free. You can have it as part of a package with a website that you're using. If it's like a massage website, there are little booklets that you can get. You can just download them offline and just print them all the time. There's different ways to do SOAP note charting. But the important thing is if insurance is involved, make sure you are doing those SOAP notes. And then after that, it's just a good practice to get into to do SOAP notes at some level with clients, especially if they're coming in for more than just simply relaxation. Okay. Now we have a project that we're going to be doing as well. Okay, and I'll attach a SOAP note to the Canvas site as well for you to see what that looks like. But you're going to do a project. So you need to do 6 individual SOAP notes. And these SOAP notes are all going to be on the same person. So the SOAP note is going to be done, or the first SOAP note is going to be done after, so post your first massage session with them. And each time we do a SOAP note, it always happens after a massage session. And we try to do it as soon as possible because that's when everything's fresh in our mind as to what we saw, what we felt, what we talked about. Because if it's like a day later or 2 days later or something like that, we just tend to forget about that kind of stuff. So what we're doing is 6 SOAP notes. And I'll tell you the due date here in a second. But it's going to equate to at least about 1 per every week, a little over a week or so with this person. So we want you to make sure to pick one person that you have frequent contact with that you can do a session with once per week. It could be a family member, it could be a friend, whoever it is, they're super lucky because they get one 60-minute, approximately 60-minute session with you per week or per every 8 days or something like that. So you can complete this project. Okay. It's going to have an evaluation portion of this, which is also completed by the client. So the client fills out an eval based on how they felt the session went with you at the end of each one of these. And yes, each one of them. So you need a SOAP note for each one that you write. You need a client evaluation, which they do for each one of those. So you'll have 6 of each of those when you are completed with this. And then you're also going to have a report that you do. And this isn't a huge, like 15-page report or anything. This is just a page and a half or so report that's going to basically detail everything that you did, put it in a nutshell. And so you're going to summarize the findings from all these different areas of the SOAP notes. So your initial complaints and goals of the client. So this is, a paragraph that is writing about, hey, when this client first came in from the intake form, this is what I gathered. And from our initial talk that we had after we did the intake together, this is what I found out. Okay. And so that's from that initial SOAP note where you get this initial complaint and goals of the client. Okay. I want to reduce pain. I want to sleep better. I want to do this or that. Then you're also going to have a section that talks about the initial assessment of the client, too. Okay. And this is from the initial SOAP note as well that you do. So you look back to that first SOAP note you did and say, okay, on my A portion, this is what my assessment was. Then we're going to do a summary of the treatment also. Now, this is from all the soaps. So when we look at that treatment portion, we're going to say, okay, of all these treatments that I was doing, this is how it progressed. This is how it may have changed over time. But this is a summary of the treatments that I gave this person over the 6 sessions. And then you're going to write a final assessment of the client as well. So based on everything that I did, here's my final assessment. Okay, so this is where this person started, and this is where they finished. Maybe this is what our goal was, our short-term goal was in the beginning, and this is a long-term goal that we had, but this is my final assessment of what happened. And then you're also going to give a recommendation for future massage too. So off of that final SOAP note that you write, you're going to have at the end, okay, that P, that plan, you're going to say, this is my recommendation for this person, this client, based on everything that I've seen from them this past 6 sessions. This is my recommendation. So it's going to be recommendations for massage, recommendations for chiropractor, recommendations for whatever you think. It could be just massage. It could be a handful of things, but you're going to say what the recommendation is going forward for that person. Okay, so some guidelines here continued. Okay, that final narrative report. So this is just talking about as a whole now, so not the individual component parts or whatever. So the final narrative report should be a summary, short, no more than a page and a half of the initial and final subjective findings. Okay, so remember subjective findings, what the person's feeling. So you're going to get their take on things, the course of treatment that you provided, the response to treatment, they got better, they got worse, whatever it was, but use objective language, and how the patient's progressing and any changes that need to be made. So there is a sample and guide sheet that I'll be posting as well. So you can look at that sample, which gives you an example of some things that you could be putting in here and what it should look like. And it's just a 1-page example of all these components broken down and summarized. So you can kind of see what that looks like. And then you do your own version of that. Okay. And then this is going to be graded for 100 points. Okay. If you don't have something present, then you may get docked for that area. Okay. So if anything's incomplete, you don't get the points for that. So the initial intake form, the first one that you do with them, is going to be worth 8 points. So a full intake form. Again, that's going to be attached. Then it's not the SOAP note, it's the intake form. Then that's something they fill out. Then we do 6 evaluations. Okay, 6 evaluations, and the 6 of those that people have written on you, those are 2 points each, 1 per session, because you have to do 6 sessions. Okay, so that turns out to be 12 points. Then you do 6 SOAP notes. So those are the charts that you're writing up, those SOAP notes. Okay, those are 10 points each. Okay, 10 points each because you're doing the work on those, not someone else per se. Okay, so that's worth 60 points. That's the bulk of your grade here. And then you do your final narrative report as well. Okay, that's what you're going to do at the end, and that's worth 20 points. That's the page and a half that you're doing at the end. So the first 3 things there are just kind of done as you're going. Okay, so the initial intake form is done up on that first session. And each one of those evals is done at the end of each one of your sessions. And then the SOAP charts are done at the end of each one of your sessions. Okay, so those are all in progress through the next 7, 8 weeks or so. And then the final narrative report is what you do at the conclusion of all those. Now, you may get them done early. Okay. I would I would think, a once a week type of treatment would be best for the person instead of doing like 6 treatments in 2 days. Um, but at most, I would say do 2 treatments on this person per week, which would get you done in a few weeks if you did it that way, well ahead of time. Okay. But if you are going to try to do once per week or so, make sure you kind of schedule out those times in advance, get them to put that on their schedule and you put it on yours just to make sure that you're going to get those in. And so you're not trying to cram in a few sessions at the end. Okay. Because a few sessions just crammed together really don't show you progress of the person as much. Okay. So that is the 6 SOAP project that we have that is due. And that due date is going to be for you. Um, well, I won't say the due date if I have to use this again for other classes, but that due date is going to be listed on your form on Canvas. Okay. So if you have any questions, again, feel free to reach out to me. I'm always available via email and try to get back to people right away. You could also text or try to give me a call too. All right. Thanks, everybody.